Good evening and welcome to this first edition of The Checkpoint right here at Urban. I am Nicholas Wasaja, your host. The Centers for Disease Control and Prevention is one of the major operating components of the Department of Health and Human Services in the United States of America. The institution protects America's health, safety, and security threats both at home and abroad. At the core of its mandate is research aimed at fighting disease and support communities to do the same. CDC started its work in Uganda in 1991 and established its office in 2000 with focus on prevention, control, and treatment. The agency has treated tens of thousands of people living with HIV and AIDS and responded to over 35 outbreaks in Uganda. CDC has maintained a polio-free status and helped us deal with malaria, TB, as well as other health concerns. Now, in the wake of the coronavirus disease, it is only prudent that we talk to CDC and its work in Uganda. My guest tonight is none other than the CDC Country Director, Dr. Lisa Nelson. Dr. Lisa joined CDC in Uganda in 2017, tagging along with a wealth of experience in public health. Interestingly, Dr. Lisa is both a political and health scientist. She holds a degree in political science from Yale University and a medical degree from the University of California. She has also studied epidemiology and health sciences at master's level from the University of California. Dr. Lisa is a pediatric infectious disease fellow from Boston. A mother of three, Dr. Lisa also speaks French, Portuguese, and Spanish. She enjoys traveling and outdoor activities with family. Dr. Lisa, welcome to the show.
Thank you for having me.
Tonight, we are going to discuss COVID-19 in charge of finding a remedy. And my belief is that CDC is at the center of this pandemic. So, but before we go into the ramifications of COVID-19, as CDC, what exactly is your contribution to global health security?
Sure. As you've laid out, Nicholas, the CDC is a public health agency of the United States government. We're part of the Department of Health and Human Services, which is like the Ministry of Health in the United States. But since its inception, CDC has also worked on global health. We provide technical expertise to multilateral organizations, and we also have over 44 country offices in countries like Uganda, where we work in partnership with the host government, Ministry of Health, with other partners and with others on the ground to provide technical support and financial assistance for public health programs and for diseases of public health importance like HIV, TB, malaria, and now COVID-19.
Do you have any collaboration with governments in third world countries to build capacity in detecting and preventing infectious diseases?
Yes, we do. First and foremost, we work on the core building blocks of a public health response. So that's the workforce, training epidemiologists and other public health professionals, laboratory systems. So that's building capacity in countries like Uganda to detect diseases like Ebola, like HIV, etc. Working on public health research, and also more recently supporting emergency operations. So Uganda has an emergency operations center. One of the things we do is provide support and training for that emergency operations center to function.
But COVID-19 has dismantled the entire global health system, and it seems like it has brought it to its knees. Is this because you people in charge of epidemiology slept on the job, or it's just a question of being overwhelmed?
Sure. I think the COVID-19 outbreak, which began in late December, the first notification to the World Health Organization was on December 31st, has really been unprecedented. It's probably the biggest outbreak since the influenza pandemic of 1918. So in that sense, it has really overwhelmed many countries' abilities to diagnose and treat this disease. But I think as a global public health community, we have been aware for some time that viruses like SARS, like MERS, like different kinds of influenza viruses can cause worldwide pandemics. And really, since about 2013, the world has been working on what we call the Global Health Security Agenda. And Uganda has actually been a leader in that effort to prevent, detect, and respond to global disease outbreaks. So while this particular virus is unprecedented in its scope, I think the world has been anticipating something like this and working to prepare.
You've talked of SARS, but people interchangeably use coronavirus and COVID-19. Probably, could you help us educate us on the difference between any other coronavirus and then in particular COVID-19?
Sure. So there is a family of viruses called coronaviruses, corona meaning crown, that are related. And we know that some of the emerging infections in recent years, like SARS and MERS, are part of this coronavirus family. This particular virus, which we identified in early January and WHO has named COVID-19, is also called the SARS-CoV-2 virus. So it's part of that family of viruses.
My understanding is that you've been working closely with the Ministry of Health and the Ugandan government. But on a scale of 1 to 10, how would you rate Uganda's response in relation to COVID-19?
I think, quite honestly, Uganda has been doing really well. I'd say maybe 7, 8, depending on how you want to look at it. I think no country was entirely ready for this virus, and I think one of the things we've talked about is efforts to flatten the curves so that if and when Uganda gets more infections, they don't all come at the same time. So there's certainly things Uganda needs to keep doing, but the fact that investments from organizations like CDC and other U.S. government agencies to build laboratory systems, to train public health professionals, to invest in data systems, meant that Uganda was better prepared than other countries. And the other thing, the other reason I would give Uganda high marks is that many of the measures were put in place even before we identified the first case here, and that is information to the community about how they can prevent infection, stay home if they're sick, wash their hands, practice social distancing, screening at the airports, more recently screening at the border posts, closing down nationwide. All of those things were done relatively early in Uganda, even compared with some of her neighbors.
Managing diagnosis and reporting cases for possible treatment of infectious diseases is one of the challenges that we face in third world countries, especially given the issue of access to facilities. How does CDC support these efforts?
Sure. So I think the laboratory system is extremely important. We'd ideally like to diagnose each and every case of COVID-19. We've seen even in countries in Europe and the United States, when you have a large number of cases, it's not always possible to diagnose each and every case. But having a system where the right diagnosis can be made, so you know who is infected, and then you can do contact tracing around that to identify who that person has come into contact with, get that person into quarantine, and test those contacts is important. And over the last 2 or 3 decades, CDC has supported Uganda to build really a very high quality laboratory network. A lot of that was based on funding for HIV, but Uganda has over 100 hubs around the country that serve as points of collection of specimens that can then be sent to Uganda Virus Research Institute for testing, and those results can be returned to clinicians who are treating those patients.
How can Uganda be supported to do the most important mass testing as a way of dealing with the dangers of especially asymptomatic cases?
Sure. So all countries right now are really working towards testing as many people as possible. So we're fortunate in Uganda that that there are many machines, the platforms where the laboratory testing can be done, and many laboratorians that have been trained to do that test. Right now, testing is centralized at Uganda Virus Research Institute, but efforts are underway to bring some of these other labs where the machines are available, the trained personnel are available, to be able to do the tests once we have reagents. I think the other thing is this is a very dynamic environment, and new tests are coming on board every day. So what we'd ideally like to be able to do is have point-of-care tests, like a pregnancy test where results would be available in 20 or 30 minutes, and we'd have high-quality, accurate results. Right now, there aren't that many tests on the market that are available, and countries like Uganda are having trouble getting enough of those in. But I think in the near future, the goal would be to decentralize testing as much as possible, and where we can use high quality, rapid diagnostic tests at the borders, at other points of entries, we would work towards doing that. I think because this is a new virus and because the science is evolving very quickly, I'm hopeful that in the next couple months we'll have even more ability to test more people.
Scientists have urged people to wash hands and use sanitizers as a way of killing this virus. Help me reconcile. How is it possible that we can detect that use of soap and water and hand sanitizers is available, but there is no knowledge on a cure in place?
Sure. So any respiratory virus like coronavirus, the measures that are needed are sort of social distancing first and foremost. So if people are sick, they should stay home. If they're coughing, they should cover their cough. Frequent hand washing. So if you touch a surface that's been contaminated, you clean your hands. You avoid touching your eyes, nose, and mouth, and that sort of thing. So those kinds of things are known. I think the reality is that this is a new virus, and so we are learning all the time. You may know, and I think many people are anxious to hear about developments for vaccines and treatments for this virus. And I think many researchers around the world are working together to identify candidate vaccines, to test them in animals and then in humans and clinical trials, and to do the same with therapeutic agents. But again, we didn't know this virus was out there until late December, so we're only now in April. That hasn't given scientists very much time to develop treatment options and vaccines.
So what exactly has aided the spread of the virus? You could help us answer some myths that how does it respond to cold or hot temperatures?
Sure. So like many respiratory viruses, it's passed from somebody who is coughing or talking when those droplets either are in the air and breathed in by somebody, but more likely when someone touches a contaminated surface. So I think that, sorry, I'm forgetting, the second part of your question was about the role of climate. So a lot of experience with influenza viruses, and in colder climates, we typically see in the United States, for instance, we see an increase in cases in the fall, in October, November, and generally by April, we start to see a decline. And any given year, depending on the strain of influenza, depending on how well that particular vaccine is working that year, we may see more or fewer cases. We have less data from more warmer climates or more temperate climates like Uganda. We do know there's influenza here. We also know that it has some seasonality to it. I think early on, people had thought that perhaps this virus would go away in April. That's sort of what happened with the SARS virus in 2003, was that when the weather warmed up, we saw fewer cases. Unfortunately, with this virus, we're really not seeing that. We see in many countries case counts are continuing to go up, and there's plenty of countries in Africa, almost every country that has reported cases. The virus got here a little bit later than it did in Europe or in the United States, but it doesn't seem that this virus minds a warm climate, unfortunately.
Can a person's immune system help them fight the virus?
Absolutely. So of the more than 3 million confirmed cases, we've seen many hundreds of thousands of people recover from this virus. So the good news is that young people in particular, some of them have no symptoms, or if they have symptoms, they have very mild symptoms, so their body is fighting off this infection. Unfortunately, we know that people who are older, people who may have pre-existing health conditions, may have a harder time fighting off this virus. But absolutely, most normal, healthy people, their body will fight off this virus.
Doctor, there have been conspiracy theories that this virus is actually man-made. Is this really true?
We have no evidence of that. I will say that, again, it's a new virus. We're learning things all the time. We do also know that new viruses or novel infections often come from animal reservoirs. So in the case of Marburg virus, for instance, we know it comes from bats. In the case of Ebola, we suspect it comes from bats, but we've had difficulty exactly finding the same strain in bats as we find in humans. And so it's possible as a novel coronavirus that this virus came from an animal reservoir, but I think a lot of research is still underway to determine where the virus came from.
But are there actually man-made viruses apart from COVID?
I think people can do a lot of different things in the lab, but I also would caution that there's a lot of misinformation out there. So as far as I know, researchers are still trying to determine exactly where this virus came from.
Okay, so CDC through PEPFAR has been supporting initiatives around TB, malaria, and HIV. However, this, like many other initiatives, has been affected by COVID-19. Should we expect continued support now that COVID has dismantled economies all over the world, including the US?
Yeah, so as you rightly pointed out, the U.S. government and CDC is one of the agencies that is heavily involved, has invested in many different health initiatives here in Uganda. The President's Emergency Plan for AIDS Relief, or PEPFAR, the President's Malaria Initiative, PMI, and this has allowed us to fund many different activities in Uganda related to particularly HIV, malaria, tuberculosis, but more recently the global health security agenda. I think the good news is that the funding for those initiatives has continued from our Congress and from the American people. And then more recently, there is money being set aside to address COVID-19 globally. But we have money for the next year secured for the PEPFAR program, for the malaria program, so we anticipate that those programs will continue.
There's been a strong gut feeling within sections of people that is it really possible that with all the technology that is available on the world, we could really fail to find a cure or a vaccine as immediately as possible to curb the spread?
Yeah, well, and unfortunately, I'm optimistic that a vaccine will be developed. So I heard the other day from the head of Uganda Virus Research Institute that there are 6 vaccines that are in phase 1 clinical trials. I also read in the paper the other day that Oxford University has really the lead on some of the most promising vaccines. So I think there are probably dozens of vaccines in the pipeline that are under development. I think the challenge is it takes time. Number one, vaccine, and then we have to document the efficacy, that it actually works in humans, and it just takes time to do those kinds of clinical trials. But I will say we have some of our biggest disease threats in places like Uganda, HIV, TB, malaria. We've really failed to develop effective vaccines. Now, those are different pathogens, but you know, it's possible that it will take longer than we would like to find a vaccine for this.
You previously talked of Uganda's efforts to start clinical trials and all that, but there are some reports that indicating that Africa is actually not generating enough essential data to support vital tracking on how the virus mutates as it spreads for development of diagnostic tests and a possible vaccine. Please speak to this.
Sure. So I think one of the things that's been really remarkable about this outbreak is how much international scientific collaboration there has been. Literally dozens of new scientific publications every day from all around the world. The genome was shared with the scientific community very early on so that people could begin to work on diagnostic tests and therapeutic agents and vaccines. So Uganda is an important part of that. As far as we know so far, the virus that we have here is the same virus that everybody else has. But I think it is important that Uganda continue to participate in global scientific efforts. There are many very well-trained and highly regarded Ugandan scientists. And as you may know, there is a scientific advisory committee that's providing recommendations to the Ministry of Health and to the government of Uganda. And I think many of those people are involved already in scientific collaborations with our National Institute of Health in the United States, with research institutions in the UK. So I do believe that as and when vaccine studies get underway, that Uganda may be able to participate and even lead in certain aspects of important research.
But in terms of research, probably you could be in the know. How has Uganda progressed in trying to find a possible vaccine and treatment?
Sure. Well, I think Uganda Virus Research Institute is part of many vaccine studies, HIV vaccine studies, Ebola vaccine studies, and they may very well be, as we speak, engaged in vaccine studies related to COVID-19. I'd have to check with my colleagues at UVRI. I think the other thing that I wanted to say is that Uganda is part. The World Health Organization has several multi-country studies that they have put forward. One is called the Solidarity Study that's looking at treatment options, and Uganda has submitted this proposal here to be part of this multi-country study to look at different treatment options.
Some reports have indicated that Africa is the next epicenter for the virus. What can be done to be ahead of this kind of situation?
Sure. So what is true is that we see case counts rising in many African countries. As I said, some of that's a function of time, that the virus started in Asia, it spread to Europe, it spread to the United States, and it began coming into Africa from people traveling a bit later. So I certainly don't think we're out of the woods yet. I think all of the things that Uganda has been doing will help. So first and foremost, taking responsibility at the individual level to reduce your risk. If you're sick, you stay home. If you're coughing, you cover your cough. If you as much as possible, practice the social distancing, washing your hands, all of those things that will protect you from getting coronavirus, but quite honestly will protect you from getting other viruses that are circulating in the community. At the public health level, Uganda has been doing a lot. Certainly, as we know, screening travelers early on, putting out messages to the community, more recently screening truck drivers who are coming into the country, and collecting data. And I think the Emergency Operations Center has a situation room now that's operating 24 hours a day, looking at data, looking at where new positives are coming in and how the contact tracing efforts are going, looking at all of the different systems we've been putting in place to do the laboratory testing, to do the border screening, to do other kinds of monitoring. So, I think Uganda has really done a lot of what we would want to see happen to prevent this disease from coming to Uganda, and when it arrives, to contain it very quickly.
Doctor, some scientists have suggested that Africans should be the guinea pigs for testing, making trials for a vaccine. What is your take on this kind of comments?
Sure. Well, I don't think anybody should be a guinea pig for scientific you know, really the way we've been approaching this virus has been scientific collaboration across the globe. And I think, as I mentioned, there are many Ugandan scientists who already have collaborations with academic and research institutions in the United States, in Europe, and around the world. So I'm hopeful that Uganda could participate, but as with any research, there's an ethical review process that has to take place, and participants have to consent, and that should happen here just as it should happen anywhere.
Media has recently been awash with stories that President Donald Trump actually suggested that patients should be injected with disinfectants. From a scientific point of view, is this really feasible?
Yeah, I think what he said was really confusing. I think it's important to recognize that when we say disinfectants, usually we mean things that we're using that are alcohol-based to clean surfaces or to wash our hands. And so certainly we need to follow the science, but many of those compounds are quite toxic and would not be appropriate to put them in high concentrations in human beings.
Risk communication is usually dependent on accurate messaging. Comment on Uganda's COVID-19 messaging.
Yeah, so I think, you know, starting with Minister Acheng and leadership within the government of Uganda, your president and others in the Ministry of Health, they have been very active, holding different types of media events. The president has addressed Ugandans many times. I think all of that's really important. I think one of the things the World Health Organization has been starting to advise countries on what they should consider to begin to lift the lockdown, and that is certainly something that Uganda has considered. And an important aspect of that is risk communication right down to community level. So, you know, it's important that the leadership of countries like Uganda talk about this virus, that scientific experts talk about this virus, that people talk about this virus in their households, but these messages have to get down to community level. So I think a lot of the effort more recently has been developing messages in local languages that can be shared, working with local radio stations in communities, and even providing megaphones so that this kind of communication gets really right down to community level. Because at the end of the day, we're asking people to change their behavior, and it's likely that's going to need to take place for quite a long period of time. And for people to really practice behavior change, it starts with an understanding of why that's important.
Doctor, the question of stigma is one of the challenges that is actually baffling health workers and caregivers. How do you think this could be handled?
Sure. So I think it's understandable. This is a new virus. People are afraid, and sometimes fear causes people to shun other people with the disease, or to take flight, or to take action that isn't all that helpful in a public health response. So I think the more we can educate the public, we can educate people with the disease, contacts of the disease. It's reassuring, as I said, that a large percentage of people who get this virus will actually have few or very mild symptoms. And most people will recover. Obviously, we want to prevent as many people from becoming infected as possible, but I think it's important to recognize that many people will recover from this virus, that we know that there are ways to prevent us from getting it, and to trace the contacts of people who've been exposed. So I think part of how we combat stigma is to make sure that people are armed with the right information, and that people in leadership positions, health workers, the media, and others are promoting correct information. With social media, unfortunately, we sometimes see the propagation of a lot of misinformation. So I think all of us have an important responsibility in making sure that correct information is shared.
The CDC has done tremendous work in developing Uganda's capacity in testing, research, and surveillance of epidemics, which has helped us which has helped us respond to this pandemic more positively. However, this capacity appears to be largely centralized. What is CDC doing for local and upcountry health facilities to ensure that its work is a bit more decentralized?
Sure. So yes, not surprisingly, our office is based here and a lot of our activities are based here. But in fact, many of our efforts really do cut across all of Uganda. So laboratory systems, we've talked about the fact that also that we've trained a lot of laboratorians and accredited actually at the international level quite a number of labs. I visited Chiriandongo about 2 years ago, which was the first public lab that was accredited in Uganda. So laboratory systems, we've definitely decentralized. One other key component are data systems. And so we have worked to train village health teams to suspect cases of concerning diseases like Ebola and like plague and report those and support reporting using smartphones and integrated disease surveillance systems that go right down to the village level. I think the last example that I would give is the public health workforce. So yes, many people have been trained here in Kampala, but we also have a frontline program that trains epidemiologists and public health professionals in all the districts in Uganda, again, to recognize diseases of public health importance, to report them and to respond.
President Yoweri Museveni's last interview with the media, he expressed optimism that we are progressing in trying to bring down the curve. When we come back from the break, we shall start from there.
Okay, thank you.
Welcome back from that short break. You're still right here at Urban Checkpoint. Your host, Nicholas Wasaja. Doctor, would you consider Uganda's infection rates to be called a curve that is flattening or climbing? How would you characterize Uganda's infection trends?
Sure. I think if you think back to the first case that was confirmed on March 21st, and those early days, we saw quite a number of new cases every day. And since that time, we've seen relatively few. Now, there was one day recently where we had, I believe, 11 new cases in one day. But when we look at the trends in Uganda and we compare them to some of the neighbors like Kenya, like Tanzania, I think it's fair to say Uganda has flattened the curve a bit. I think that the measures that the government have put in place and that Ugandans have been adhering to have helped. So yes, I do believe over the last month to 6 weeks, Uganda has flattened the curve. But the challenge is we're not out of the woods. We need to maintain a lot of these measures. And as we look to perhaps lift the lockdown, it's going to be really important that we continue to track what is happening with this epidemic.
It seems like tracing and testing is the way to go. How are you preparing to help Uganda do more testing, even as they're flattening the curve, to do more testing to ensure that we identify patients and so that they're able to get treatment?
Sure. So I think the countries where they have successfully contained the epidemic, like South Korea, widespread testing was key. Testing of suspect cases, testing of those contacts. The challenge is around the world. Everybody wants to be doing testing, and these tests are new, and getting reagents to run the tests is a challenge for all countries. But I think here in Uganda, the first thing is that right now the testing is centralized at Uganda Coronavirus Research Institute. They've been doing a really good job, but we need to have more labs that can perform this testing. The good news is many of these labs have the machines to perform the tests, and they have laboratory personnel who've been trained. So I do know that the effort that's underway right now is to plan for more tests, perhaps 8, 10 or more labs to be doing this testing in the near future. The other thing is to work with international partners to get our hands on the reagents to do the testing and to make sure that laboratorians are trained and to do the testing. I think the other thing moving forward, as I talked about, is right now we're doing molecular testing, PCR-based testing. But what we'd like to move towards is point-of-care testing, where we can do a rapid test and have the results in 20 or 30 minutes. Right now, we're working on getting those tests into the country, validating them, and making them available. The last thing I would say, though, is this is a very dynamic area. Many different manufacturers are working on better tests, validating those tests, and producing them in large quantities. So I think we're going to have to continue to work as partners to look at what tests become available and how we can make them more widely available in Uganda. Lastly, though, I would say that we do need to scale up testing, and Uganda yesterday alone did 2,400 tests. So we are doing quite a large number of tests in Uganda, but we also need to be smart about testing the right people, because even in Europe and in the United States, we're finding when you see large numbers of cases, you don't necessarily have the ability to test everybody you would like to at once. So making sure that the testing strategy that we're using is fit for purpose.
Well, we are all positive that we are making progress, but painting a worst case scenario picture, which ones would you consider hotspots, and how can they be handled so that we do not get into that kind of position that might overwhelm the health system?
Sure. So that is a really important question. I think, as we've talked about early on, the airport, people flying in from high burden countries was a source, and that's the reason that the airport was closed for all but a very few number of flights. It then became apparent Uganda is a landlocked country, but goods have to flow. Certain commodities have to get into the country. So building the capacity for health screening and for testing at the border points was really important. Moving forward, I think you may have heard that Uganda launched a community surveillance survey yesterday. And part of the purpose of that is to determine, are there cases out there in the community that may have gone unnoticed because people had mild illness or because we just didn't detect it through our systems? So that information over the next week or two is really going to be helpful. I think as Uganda looks to beginning to lift in a stepwise and safe fashion some of the lockdown measures, it's going to be really important that those lab systems and those data systems help us to determine where there are new cases and to be able to respond quickly, to do more testing, to do more contact tracing, and to understand where cases are coming. Uganda has many neighbors. It has porous borders. So I think we have to expect, as you said, a worst case scenario that cases will cross into Uganda, whether it's by borders, land borders, or people crossing the lake. I think as eventually Uganda will look to reopen the airport, we're going to have to think about how we screen passengers in an efficient but an effective manner. And then we might have some surprises. I think the thing about infectious diseases is, unfortunately, they're very clever, and we'll have to look. The other thing I would say is the healthcare workers who are providing care for patients are an incredibly important resource. They are putting themselves at risk, and efforts are underway to also screen health workers regularly so that we can do our best to keep them safe.
We have just a few days to ending our lockdown. But Doctor, like you ably said, that social distancing would require stringent measures like the current lockdown that we are going through right now. How do you reconcile containing the spread and the pandemic with preserving people's sources of livelihoods?
Yeah, I think that really is a huge challenge around the world. We know that this virus has had a tremendous economic impact in virtually every country. But at the end of the day, it's hard to keep a country in lockdown indefinitely. So I think that that is something that the government of Uganda, together with its partners, is actively discussing, trying to identify, are there at-risk groups? We know that worldwide, people who are older have a higher risk of severe outcome and death from this virus. So certainly in the United States, for instance, in Europe, nursing homes are a big source of concern. I think in Uganda, we need to look at who those potentially vulnerable populations are and what measures need to be put in place. And I know that many Ugandans are thinking, well, when might schools reopen? When might churches reopen? When might markets reopen? And I think that the conversations that are happening right now are looking at what is the risk, what is the benefit to, and then what is the risk, and trying to do our best to balance that risk-benefit ratio.
There have been fears that this virus might have to stay with us forever. But can you throw more light on these fears?
Yeah, the reality is, as a new virus, none of us really know. Many people have looked back to the largest outbreak, that many of us are aware of, which was the 1918 influenza pandemic, and it took 2 to 3 years. The virus swept through many countries, but then it came back for a second wave, and in some cases for a third wave. I think that that's why a vaccine becomes incredibly important. Even if it takes a year or more to develop, it might mitigate that second or third wave of infections. But I think what's becoming clear, even for countries that have successfully flattened their curve, they're not out of the woods, because as long as that virus is still circulating, and as long as you have people who are non-immune, who haven't seen the virus, the risk of infection is still there. So I think this is going to be with us for months, if not years, unfortunately.
Well, it could stay with us for as long as we can wait, but how could we prepare for a second wave?
So I think all the measures we've already been putting in place, screening, social distancing, good hand washing practices. I think when new tools become available, like vaccines, in the past, 20, 30 years ago, vaccines were developed, but they would take a long time to get to countries like Uganda. There are global initiatives like Gavi that have made vaccines, including the Ebola vaccine, available much more quickly. So I think being ready that when there are new tools such as vaccines or new treatments, that Uganda can have access to them is really important. I think following the data, I think we've learned in our experience from January to now that international travelers are an important risk group. We've learned that people crossing borders are an important risk group. We know that healthcare workers, just by virtue of their occupation, are at risk. So I think making sure that we're thinking about who those risk groups are and where the risk would come from if things go quiet for 6 months, but we know the world is still at risk. We've learned a lot about how to think about this going forward.
Doctor, what kind of multi-sectoral response would you recommend in preparation for a future pandemic?
Sure. So, I'm most familiar with the health sector, and I think that we have had excellent collaboration with the Ministry of Health, with other parts of the government of Uganda, with partners here on the ground like WHO, other U.S. government agencies, and others. But of course, the economic impact of this goes well beyond just the health sector, and I certainly think other parts of the government, other parts of civil society are really key. So I think the partnerships that we've already built are going to be important going forward. I think everyone really has a role to play. Certainly also, we've seen acts of generosity around the world, and even here in Uganda, people wishing to donate money, people wishing to volunteer their time, people who have whatever skills they have, bringing them to bear. It's really been great to see.
Uganda has been commended for championing the fight and contributing to research on HIV and AIDS, Ebola and TB. As CDC, is this just a hype, or is it a true reflection of efforts that the government of Uganda has been making to ensure that they curb these kinds of health concerns?
No, I think that I think it's largely true. You know, Uganda sits on the margins of the Congo Basin, so it's at risk for certain kinds of infectious diseases like Ebola and Marburg. Uganda was also hard hit early on by the HIV epidemic. But I think that has also led to many very well-trained Ugandan scientists who've been doing really global research in the diseases that you mentioned, HIV, malaria, Ebola, and others. And I think that, you know, I've worked in many countries on the continent, and really the number of Ugandan professionals who are doing research at a very high level, who are publishing papers, who are presenting at scientific conferences is unprecedented. So Ugandans should really be proud of the scientific expertise and the public health expertise that we have. I would also say that Uganda really was a leader early on in the global health security agenda. So starting as early as 2013, 14, Uganda joined the global health security agenda discussions. As you may recall, it was October of 2017 that you got a high-level ministerial meeting, and Minister Acheng and your president hosted that. So I think Uganda really should be proud, justifiably proud of its leadership in many different areas.
Besides the CDC work in Uganda, is the U.S. administration, are there any other efforts that are being made by the U.S. administration to ensure that the world brings this to curbs the COVID spread?
Sure. I mean, I think that as you've no doubt seen in the news, the United States right now is focused on, you know, our own epidemic. But as I mentioned, there has been money set aside to address the global COVID-19 pandemic, and I think that you know, we're like everybody else interested in working together to address this pandemic. And I think our National Institute of Health has played a leadership role in developing vaccines for HIV, which unfortunately we don't have an effective vaccine yet for HIV, but for Ebola. And so I think that we certainly also, through NIH and some of our other institutions, are helping to promote the research agenda, and no doubt will also continue to do that for COVID-19.
Doctor, you are an ardent lover of outdoor activities. How have the dictates of ensuring that social distancing to curb COVID-19, how have they affected you and your family?
Well, we're lucky that we have a beautiful garden. I think that Uganda's a beautiful country. I listen to the birds sometimes when I work outside because many of us are teleworking when we're not coming in for events like this. But I am looking forward to being able to go visit the national parks again, to being able to go, you know, exercise in my neighborhood and that sort of thing. So I think, like many people, I'm hopeful that in the coming weeks we could get back to some of the things that we would ordinarily be doing.
Your parting shot, Doctor.
Well, thank you for having me on the show. I think, as I said, the media has a really important role to play in fostering dialogue, in getting accurate information out there, making sure that all Ugandans do their part. I think I'm very grateful for the collaboration and transparency that we have here in Uganda. We're not out of the woods yet, but I would say that it's a credit to many of the institutions here that Uganda has done its best to keep this virus at bay, but it's probably something we're going to need to continue to work on for months, if not years. So thank you again for having me. It's been a pleasure.
Dr. Lisa, we don't take it for granted that you've taken time off to join us on the Checkpoint. We've been talking to Dr. Lisa Nelson, the Country Director, CDC Uganda. Be sure to catch me at the Checkpoint tomorrow with yet another informative discussion right here at Urban. Stay tuned.